The 2011-2012 budget announced yesterday allocated 995 billion shillings to the health sector, an increase of more than 300 billion shillings from last year's budget. This allocation provides more money for drugs, 96 billion shillings, and 24 billion shillings for reproductive and maternal health. Other priorities outlined in the health budget include the rehabilitation of Mulago National Referral Hospital, the construction of a maternal and child health center and new district hospitals in Kawempe and Makindye divisions of Kampala. But critics say the budget allocation is inadequate overall and that it left out the critical challenge of health workers' salaries and incentives.
One of the critical reasons why the health sector is functioning poorly, that we are paying poorly the critical cadres in the health sector, particularly doctors, nurses, and midwives. Currently, the staffing level is at 56% in the health sector. But even when you look critically at who are the health workers there, they are not the critical staff. The medical officers, the midwives are not there.
The current starting salary for a medical doctor in Uganda is only about 700,000 shillings a month. But even the lower cadre staff, such as nurses, who do most of the work, are grossly underpaid.
You can find a nurse earning as low as 200,000. This is a nurse who has a family, who has to take care of their children going to school, who has to take care of other business, who also has to access health services. We feel that the health workers are the drivers of the health system. So even when we make drugs available, even when we renovate hospitals, but we don't have these health workers in these hospitals, I think health service delivery will still remain very poor.
Aside from funding, the critics say there's urgent need for policy changes regarding recruitment of health workers. The sector also needs to manage the available resources well and get rid of gross mismanagement, inefficiencies and wastage that have denied the population access to adequate health services. Anna Tkunda, NTV Tonight.